Hello viewers, welcome to Learning Lane. Today we're going to see hemorrhoids are a common health problem. They happen when veins in your rectum and anus swell. Imagine them like varicose veins, but in a more uncomfortable spot. Most people feel embarrassed to talk about hemorrhoids, but remember, they're very common. You're not alone. Hemorrhoids can be painful and itchy. They might bleed, especially after a bowel movement. The good news is they are usually harmless. They often get better on their own or with simple treatments. Knowing about hemorrhoids can help you feel less worried. It can also help you take steps to prevent them. If you have any concerns, talking to your doctor is always a good idea. Let's learn more about what causes hemorrhoids, their symptoms, and how to find relief. Several things can lead to hemorrhoids. One of the biggest culprits is straining during bowel movements. This often happens when you're constipated. Chronic constipation, where you have trouble going to the bathroom regularly, puts extra pressure on the veins in your rectum. This can cause them to swell and become hemorrhoids. Pregnancy is another common cause, especially in the later stages. The growing baby puts pressure on the veins in the pelvic area, increasing the risk of hemorrhoids. Heavy lifting, whether at the gym or at work, can also contribute to hemorrhoids. The strain from lifting heavy objects puts pressure on the veins in your lower body, including those in your rectum. Age is another factor. As we get older, the tissues that support the veins in our rectum and anus can weaken. This makes us more susceptible to developing hemorrhoids. Hemorrhoids can be internal or external. Internal hemorrhoids develop inside the rectum. You usually can't see or feel them. However, they might bleed, especially after a bowel movement. You might see bright red blood on the toilet paper or in the toilet bowl. External hemorrhoids develop under the skin around the anus. They're often itchy and painful. You might feel a lump or swelling around your anus. Sometimes a blood clot can form inside an external hemorrhoid, causing a hard, painful lump. Other common symptoms of hemorrhoids include pain or discomfort, especially during bowel movements, itching or irritation around the anus, and swelling around the anus. Remember, these symptoms can also be signs of other conditions. It's important to see your doctor for a proper diagnosis. Section 4. Diagnosis and treatment. Finding relief. Diagnosing hemorrhoids usually involves a physical exam and a review of your medical history. Your doctor might ask about your symptoms, bowel habits, and any other health conditions you have. They might also perform a digital rectal exam, where they gently insert a gloved, lubricated finger into your rectum to feel for any abnormalities. In some cases, they might recommend a visual examination of your rectum and anus using a short, lighted tube called an anoscope. Treatment for hemorrhoids depends on the severity of your symptoms. For mild cases, over-the-counter creams, ointments, or suppositories can provide relief from itching and discomfort. These products often contain ingredients like hydrocortisone or witch hazel, which can help shrink swollen tissues and reduce inflammation. Lifestyle changes can also be helpful. Eating a high-fiber diet, drinking plenty of fluids, and getting regular exercise can help soften your stools and make them easier to pass, reducing straining during bowel movements. For more severe cases, your doctor might recommend medical procedures. These might include rubber band ligation, which involves placing a small rubber band around the base of the hemorrhoid to cut off its blood supply, causing it to shrink and fall off. Section 5. Prevention, keeping hemorrhoids away. Preventing hemorrhoids is often easier than treating them. One of the most effective ways to prevent hemorrhoids is to eat a high-fiber diet. Fiber adds bulk to your stools, making them softer and easier to pass. Aim to eat plenty of fruits, vegetables, whole grains, and legumes. Staying hydrated is also crucial. Drinking plenty of water and other fluids helps keep your stools soft and prevents constipation. Avoid straining during bowel movements. If you don't feel the urge to go, don't force it. Regular exercise can also help prevent hemorrhoids. Exercise helps keep your digestive system regular and prevents constipation. Aim for at least 30 minutes of moderate intensity exercise most days of the week. If you're pregnant, talk to your doctor about ways to prevent hemorrhoids. They might recommend specific exercises, dietary changes, or other lifestyle modifications to help reduce your risk. Remember, these tips can also help manage hemorrhoids if you already have them. By making these lifestyle changes, you can reduce your symptoms and lower your risk of developing new hemorrhoids. Don't forget to subscribe, like, share for more informative videos. Thank you for watching.